Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Alok Patel. He's joining us here as a pediatric hospitalist. He's going to discuss the benefits of clean label, whole plant-based nutrition for babies and toddlers. He's also going to talk a bit about why industrial and environmental contaminants, along with toxins in food and consumer products, are so dangerous. A little bit about why adding this important information to food labels is essential. Welcome to Health Professional Radio, Dr. Patel.
Thank you for the platform. I appreciate it.
Give our listeners a bit of insight into your professional background. Of course, a pediatric hospitalist. Are you a parent as well?
Yeah, absolutely. All the above. So I am a pediatric hospitalist based out of California. So I'm at Stanford University. And I also work as a journalist and a host. And I work for ABC News. I work for PBS. I do a lot of work regarding health, lifestyle, and translating all this medical information for people out there who are going to implement a healthcare professional's advice. And last but definitely not least, probably my busiest role is I am a father of a 1-year-old rambunctious human being who is exploring the world by putting everything in her mouth.
Oh, yeah, you are absolutely overwhelmed. That's for sure.
To say the least.
Well, from the perspective of a pediatric hospitalist and a dad, talk about why it's important to take advantage of clean label, whole plant-based nutrition for babies and toddlers.
Simply put, I want to know, both as a pediatric hospitalist and as this idealistic father, I want to know that I'm giving my daughter calorie-dense, nutritional, clean food. Now, what I mean by that is there are so many options out there on what we can feed our babies nowadays, especially for working, busy parents. And so, as a physician, my wife also works full-time, we're constantly trying to find shortcuts in terms of what we can feed our daughter. So that's, unfortunately, some store-bought things, some mixes. We've looked at a lot of supplements out there because the reality is we can't always cook everything at home. And so when I'm buying a product, the one thing that I always do is I'm flipping that thing around. I'm looking at the nutritional label. I want to know what's exactly in there. And I also want to know that it has enough vitamins and minerals for a growing baby. Because you will see some products out there that are devoid of vitamin D or of iron or of all these essential nutrients and maybe high in sugar, for example. And even if they're labeled as a quote-unquote healthy food. So for me, it's very simple. I'm like, let me look at vitamin D, let me look at iron, let me make sure it's clean. And also, this is the dad brain off now, and this is the pediatric hospitalist brain. I'm also sitting there, and I'm like, I should not be doing this, but I'm calculating caloric intake for my daughter. And on days when she, 5, 6, 7 months wasn't eating very well, I'm like, hold up, let me divide everything you've had today. Let me look to see how many calories you've had, and let me make sure tomorrow we're giving you more calorie-dense food and not just filling your belly with garbage. So a lot of it goes into play when I'm trying to balance those two brains of mine.
And you talk a lot to families who may be struggling to meet those nutritional and caloric needs for their kids. What do you tell them when they tell you that eating healthy or eating clean is out of their budget?
Oh, I hear this all the time. And, one of the old mantras that one of my mentors used to teach me was feed your children food that your grandmother would recognize, or at least ingredients. So what I tell these families is there is no shame. If you cannot make that pretty Instagram baby breakfast by hand, there is no shame in that. A fed baby is a happy baby. That is our number one goal. But I also tell them, if you're going to go and buy something, you're going to, pick something up at a store, a doctor's office, whatever, I want you to at least know what's in that product. In a perfect world, we will have a clean label certification on all those products so that we know, hey, this product, this supplement, what you're giving your child has gone through purity testing, and that we know that it does not contain things like arsenic, lead, cadmium, and all these other impurities that are out there, which is why I just caution families, just please pay attention to what you're feeding your kid. This is one of the big worries that we have when it comes to highly processed foods, fast food, things like that. Obviously, you're hopefully not giving that to your baby, but I'm not judging parents who the best they can. I just try to push them in the right direction, which is why, for example, when I look at a product like Elf Super Cereal, I'm like, hey, you can look it up online. You can look up what the clean label certification actually means, so you know what your child is eating. You know what's actually going in, and you can trust it.
I heard you talking about paying close attention to the labels, and I just heard you mention clean label certification. What is a clean label certification? I can remember the controversy of companies being forced to put calorie information. I can remember a time when you didn't have to put any of that stuff on your label. Talk about this clean label certification.
Yeah, so essentially, anyone can go online, and I will tell you, like, I've been working as a pediatrician for about 10 years, and this is new to me as well. But people can go online and they can look up the Clean Label Project and look to see which pediatric products are on there. This does not mean if your product isn't on there that it's automatically unhealthy or it's something that you should just avoid at all costs. But if something is on there, then you know that it's gone through a certain background of purity testing. But I also want to go back to something you were mentioning about, looking at labels and nutrition, because it is kind of confusing for parents out there, and even we should do this with our own practice. And it's helpful for us to sometimes guide families through this and say, like, hey, there is a certain amount of, I mentioned vitamin D, iron, and calcium, but even things like fiber that people don't pay attention to. And a lot of our families aren't paying attention to what the labels say, because the front of the bottle, as you indicated, makes a lot of claims that may or may not be backed by any USDA definition. If something says number 1 pediatrician recommended, what the hell does that actually mean? What pediatrician was it? How many? That doesn't mean anything to me. So what you can trust is a label, and you can trust something like the Clean Label Project. And when in doubt, chat with a healthcare professional or a nutritionist, and it will help your patients go through that. I refer patients to nutritionists all the time, especially kids who have high-risk medical conditions, special dietary needs, allergies, etc.
Tell us about Super Cereal. You mentioned it earlier. Else Nutrition recently launched this product. Tell us about it and what's in it.
Yes. So Super Cereal from Else is actually pretty awesome. Infant cereal has been around for God knows how long. When they make infant cereals, they're hyping that up with so many nutrients, protein, and good whole plant-based materials, whereas in the United States and in other developed countries, we've had these processed infant cereals, may not have a lot of nutrition, may have some things in there that we won't want to recommend for our patients. There's arsenic scares. So it's nice when I see a company like Else, launch a cereal that I'm like, okay, cool. I know it's plant-based. It's organic. It's gluten-free. It is a clean product that I can recommend to families, and I do not have to worry at all because it meets so many different standards. Because I will tell you, and, all my healthcare professional colleagues can agree with me, we have so many different dietary beliefs, needs, and practices among our patients. Some of our patients are vegan. Some of them, will only eat food that's kosher. We have a lot of patients who say, I want something that's organic, that's non-GMO. And I'm like, I don't have a one-stop shop option for all of you. And so that is what's great about the Super Cereal is I can recommend this food as a first exposure. It's minimally processed. It's got a very dense nutrition. I mentioned this earlier. I cannot stress enough how many, my pediatric mentors have made sure that I knew this when I started my practice, is to make sure that babies are getting high nutritionally dense foods because their tummies are tiny. They're going to fill up quickly. What I also really like about the Super Cereal is buckwheats, almonds, and tapioca. That is essentially what's in it. More than 80% of the nutritional value comes from those 3 ingredients. I said earlier, I want to give my patients foods that are made up of ingredients my grandmother would recognize. She would recognize buckwheat, almonds, and tapioca. So that is something
Absolutely.
that, gives patients a lot of trust.
Give us a website where we can learn more about Else Nutrition and about Super Cereal.
I would recommend people out there, you don't have to take my word for it. Go to www.elsenutrition.com, read up the articles, look at the science, look at the label. We do the exact same thing for products that we're going to recommend that we want our patients to do. That's where you should head. Check it out for yourself.
Hey, look, I appreciate you joining us here on Health Professional Radio this morning. It's been a pleasure speaking with you. Hopefully we'll speak again.
Neil, I appreciate you, sir.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Alok Patel. He's joining us here to talk about the benefits of clean label, whole plant-based nutrition for babies and toddlers. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.